Hello again, everybody. This is still the same warning as the previous video of part 2. This is part 3. I'm still in Garmisch. In fact, it's just a few minutes since the last video. I'm talking more on part 3 of signs and symptoms to look out for in somebody who's possibly considering suicidal ideations. Once again, please like and share and subscribe to this information because of the algorithm. When I mention the word suicidal ideations, it can sometimes block people and kind of gets it pushed aside in the algorithm. However, I think it's important to say the word. Sometimes I'll say self-deletion, other words like that. Anyways, getting into this, signs and symptoms. Looking at just some of my notes here that I have. So making preparations, that is a huge sign of possible suicidal ideation. Some people are trying to put their own personal business in order. So some people will start taking out a high level, high number count of money for life insurance. They'll usually do that a little bit before because some of the policies have a limitation on you have to have the policy for this long before you could. It would enact if the person was suicidal. Some of the other things involve writing a will, making visits to family members and friends that they haven't seen for a while, apologizing for things that are far in the past that you may have forgotten about, but them trying to set their house in order, them trying to make their life, put their life in order and kind of close all the boxes. So when you see somebody doing some of these things, you might want to think, hey, it's not just a nice visit, which it could simply be that, but it could also be that that person is thinking of, I want to set my life in order because my life is not going to be here soon. So that's something you really want to watch out for. Increased talk of suicide and self-harm. So I was on a TV show. I won't say which one because I don't. I want to keep the anonymity of the interviewer. So one of the interviewers on a show that a TV show that I was being interviewed on asked me this next thing right after the interview in regards to somebody that she knew personally. I think it was a friend's child, if I remember correctly. It's been a while. Anyways, increasing talk of suicide or self-harm. So I'm going to read this part, and this is specifically from the book. Studies have shown that between 50 to 75% of people contemplating ending their life will give a family member or friend a warning sign of their intentions by talking more about suicide. So this person who had just interviewed me, say thank you for the interview. She asked me, hey, so I've got this family member, their daughter is stating that it was a family member or a friend's family member or something like that. But it was an adolescent teen that they said she has started talking more that she's going to commit suicide. That's not really a thing. I mean, if they're going to do it, they're not going to talk about it, right? I mean, so she's okay. And I said, actually, that's something you need to be very concerned about because people will start talking about it more. They're testing the waters. It's kind of like when you are attracted to somebody and you kind of want to tell them that you like them, but you don't know how to say it exactly. And so you start saying little tips, trying to like kind of drop it in there. It's the same thing for those people who are considering suicidal actions. So they'll start saying this to see what's the reaction. For a lot of people, it's a cry for help. They're wanting this person to show concern, show love to them, show attention to them, to let them know that they're important. Some people might say that that's a manipulative behavior. I really don't care if it is or isn't. Because if the person needs attention and it can help save their lives and we have to work on a behavioral change later of manipulation, that's fine. We can do that if the person's alive, if the person's with us. So that's one of the things there. When the person is talking more about it, when they say, maybe I should just do this, I just wish that I could die and not wake up. We call that in the hospital settings a passive suicidal ideation, saying, I wish I would just fall asleep and not wake up. I wish that I just wasn't here anymore. It's not them saying, I'm going to take an active action of harming myself to kill myself, but if they're saying something along the lines of, I just wish I wasn't here anymore. I wish that I didn't have to wake up anymore. I wish that I could cease to exist. Those are the precursors to the other statements of, I'm going to harm myself, I'm going to do this. Another thing, going back real quick, because I just remember this, on the previous symptom that I had just said about putting their life in order and making preparations, that could involve the person getting the tools that would be required for them to commit suicide. So for some people, that would be a weapon of some sort. That for some people, it could be a poison. It could be stockpiling medications that could possibly kill the person. So when people start stockpiling these things, if you start seeing them purchase some of these different items and some of these other symptoms have been present, that's a realization that that could be them thinking more seriously about taking their own life. That's all we're going to do for this part 3. I'm going to do a part 4 here in just a moment, so stick with me. Thanks. Love you all. Bye.